Dr. Folashade Popoola, consultant clinical hematologist with a passion for helping sickle cell warriors live their best quality lives. Trained in Lagos University Teaching Hospital, Lagos, and St. James University Teaching Hospital, Leeds, she is a UK certified clinical hematologist trained in care of all blood disorders and blood marrow transplant. Dr. Popoola is the medical director, Next Hematology in Medicare, a world-class medical center in Surulere, Lagos, Nigeria, with a focus on apheresis, which includes automated exchange blood transfusions for sickle cell and a vision towards bone marrow and stem cell transplant. Also included are services for treatment of patients with blood disorders, comprehensive laboratory, theater, and consultations with other specialists. Ladies and gentlemen, please let's welcome Dr. Folashade Popoola to the Positive and Wellness Summit as she speaks on my belly, my head, how to manage pain, chronic pain, and sickle cell crisis.
Okay, we are back, and we are with Dr. Folashade Popoola. Hi, Shade. Good to see you again.
You too. You're looking very bright and beautiful.
I'm looking at it. That is why we are to help better. And today, and sickle cell crisis. 2 or 3 years ago, that I realized there was a difference between chronic pain and sickle cell crisis. I thought all of them were the same, but don't necessarily have sickle cell crisis, while some people have sickle cell crisis, but don't necessarily have chronic pain, and some people have both, like I do. So it's good to be able to talk about this subject so that people can be more informed and able to differentiate what is happening with their body. So over to you. Go ahead.
Hi, good afternoon, everybody. My name is Dr. Shade Popoola, and I'm happy to be here. I'm a clinical hematologist, and today we'll be delving into the world of pain. Not a very sweet sensation, but it's one that, sickle cell or not, regardless, as human beings, we all have pain at some point or the other. Now, specifically for sickle cell, it's important to be able to then know what kind of pain you're having and how to deal with these pain when they come. So the title, my belly or my head, was very apt, very, very on point, because that's exactly how many people feel when this pain comes up. So I'm going to start with the less known type of pain, which is the chronic pain. Now, chronic pain in sickle cell disease is defined as pain that is graded between the score of about 1 to 5 on a scale of 1 to 10, 10 being the worst pain ever. So it's just pain that is not as severe as your crisis pain, but it is pain that is there, that you know is there nonetheless. And you know that, okay, you're not having a good day, you're not having a pain-free day, but the kind of pain you're having is not the typical crisis pain. It's just, mild to moderate. And this pain is said to be present for at least half of the days of the month, which is in a month of 30 days, about 15 days of the month, one experiences that pain. And whether or not it's relieved by painkillers, it doesn't really matter. The fact is that the pain is there on a scale of 1 to 5 for at least half of the days of the month, and that's what chronic pain is. Now, chronic pain is a phenomenon that came up more recently in the past 20 years or so in the study of sickle cell disease. And it's, for some people, if you ask the older clinicians, they may tell you, is there really anything like chronic pain? We know what crisis is. which one is chronic pain. But research has shown over the years that there is such a thing as chronic pain, and it has different origins. One of the origins is seen to be as a result of frequent crises, and the body, after a while, has sort of adapted and has sort of triggered. The nerves are all sort of always triggered, such that even when you don't have a crisis pain, the nerves are triggered all the time, and you may have pain in certain areas, especially those areas that you usually have crisis in. That's usually the neuropathic kind of chronic pain. However, there are other types of chronic pain that may occur. Now, this includes the type that is caused by a traumatic injury. So, if, for instance, somebody has, say, avascular necrosis of the head of femur caused by sickle cell, they can also have chronic pain that keeps occurring in that particular location. Of course, this is identifiable and relatable to the particular pathology that's affecting that organ. Okay, if it's somebody that has had gallstones, regardless of whether they've had surgery or not, sometimes they just keep having pain in that area. Of course, if the pathology that is present is still ongoing, we still keep having this pain in this area. So this is attributable to a known cause. So that way, in this case, treating that underlying pathology many times can help to relieve that chronic pain. And then there's the chronic pain that comes from deficiencies in certain types of vitamins and minerals. One of the key findings for sickle cell was vitamin D deficiency. And vitamin D deficiency has been shown to be quite very prominent in patients with sickle cell disease. And some studies have shown that when vitamin D deficiency is corrected, the chronic pain can actually be reversed. So that's one of the things that is known to cause chronic pain. Even in the absence of sickle cell disease, people with vitamin D deficiency will have pain, muscle aches and pains and other symptoms. So with sickle cell, it seems to be more prominent for certain reasons, maybe because the body uses it up more with bone repair, and this causes vitamin D deficiency to be more common in patients with sickle cell disease. And this deficiency, especially when severe or very severe, can cause chronic pain. And until that is corrected, until that is identified and corrected, that pain may persist for a long time and can be very debilitating. So that is for chronic pain. For chronic pain, one has to first of all identify the cause. It's important to first of all see a specialist. Make sure that whoever is seeing you understands, the diversities of the origin of chronic pain and sickle cell disease, so that they know exactly what to look for. Pinpointing the cause will then help to be able to, eradicate the problem. So that I'll say is for chronic pain. Now to the more common, more frequently encountered acute pain, which we all know as sickle cell crisis. Sickle cell crises are many, Bone pain crisis, otherwise known as vaso-occlusive crisis, is the most common, which is really what we'll be talking about today. However, other crises, of course, include sequestration crisis, in which case the blood is pulled into the spleen or the liver, causes the blood levels to drop very low. The hyperhemolytic crisis, where the body breaks down the red cells more than before, causes a lot of yellowness of the eyes and reduction in the red cells as well. Chest crisis, also known as that can actually occur with a lot of pain as well, especially in the chest region. And this, in addition to the pain, one would have difficulty breathing, cough, and usually a fever. And this can be very, very fatal. So it's important to recognize early and address it immediately. Now, back to the pain crisis. So, vaso-occlusive crisis or bone pain crisis, which is the most common type of crisis in sickle cell disease, is something that occurs in, I'm sure, each and every warrior here has had some experience with it. Some people more than others, and that's the peculiar thing about sickle cell. It's the phenotypes can be very different and the presentations can vary a lot. So you may have two siblings, both with sickle cell disease, having totally different presentations. I mean, you'd have one person who may be falling ill every month and another person who rarely falls ill. And so it's important to know what your own type of, presentation tends to be. I think it's the most important thing is to be able to know yourself, especially as an adult with sickle cell or as a carer of a minor with sickle cell. It's important to know what happens usually with your child or with yourself. Now, bone pain crisis usually has triggers. Now, bone pain, of course, as the name implies, is pain occurring in the different bones of the body, different parts of the body, anywhere really, from the head to the arms, to the legs, to the ribs, any part of the body, and it just comes with excruciating pain that many times sends the warrior to the hospital, and they might have to be on admission for quite a while to be treated and to have resolution of the symptoms. So we all recognize bone pain crisis, but what is more important to recognize is what the trigger is. There is always a trigger for bone pain. In different people, different things at different times. And in our environment, if we're talking about in Nigeria, it's mostly caused by infections. Infections, mostly the most common of which will be malaria. So, which is why one of the routine drugs that is usually prescribed in any hematology clinic is paludrin or proguanil, which is an anti-malarial drug that helps to prevent malaria. Of course, if you have mosquito bites all the time, even if you're using paludrin or proguanil, you will still come down with malaria. So what's more important is to prevent mosquito bites as much as possible, with insecticides, with clearing the environment of, stagnant water, a lot of grass and things, vegetation that aid the growth of the organism. So it's important to prevent mosquito bites, to be able to prevent malaria, and of course use the preventive drug proguanil or paludrin regularly. That usually is the most common trigger for the sickle cell pain crisis in our environment. However, other triggers include dehydration. So dehydration is one of the other most common causes. So many times, for anybody who's come to, for instance, Lush or seen any specialist, you always have them say, oh, you have to drink lots of water. You have to drink 3 liters of water a day if you're an adult, minimum. And many warriors tend to drink a lot of water. It's because when the blood is dry within the vessels, it tends to stick even more. The sickle cells are already sticky, and then when there's dehydration, they stick even more to the vessels. And of course, what will this cause? It will cause prevention. It will prevent the blood from flowing properly. Now, when this happens, the parts of the body that the blood isn't getting to start to complain, and that's when the pain comes up. So it's important to be well hydrated. It cannot be overemphasized. Hydration is so key with sickle cell, especially when you're in a hot environment like ours. Another thing is extremes of temperature. So very cold or very hot environments can trigger a pain crisis. Stress, emotional triggers. Sometimes it's even something that you didn't think will trigger it. So you have a bad day or a bad time at work with your boss, or you got very bad news, or you didn't do well in exams, or you're reading for exams, and you're just very stressed mentally. These things can trigger a crisis. So it's important to slow down. Whatever you're doing, you have to pace it. If you're a student and you know you of course you have to read, you have to study. So you're not the kind of person that will be waiting till 2 weeks to the exam to start reading. You know that you have to carry your books and read every time, have your jottings, be ready so that you're not too stressed close to exams, because we see this all the time, students breaking down just before, or during exams. So emotional triggers are also very common. But of course, other infections, chest infections, urinary tract infections, other organisms within the body that tends to cause, the body to have a higher rate of metabolism would also cause, will also be a trigger for a sickle cell crisis. Now, what do we do? How do we identify? How do we prevent these things? So I always say that it's important, just as I said before, to know yourself. What are the things that can trigger my crisis and how can I prevent it? So I've said all those triggers. If we can prevent those things, many times we will not fall ill. Secondly, would be to have a plan, a pain treatment plan, I always call it. Now, first of all, it's good to have a diary. So there's a pain diary that you can create by yourself for every day of the week per month, and you just tick, at the end of the day to say, okay, today I didn't have any pain. You tick it. Next day I didn't have any pain. Oh, third day, oh, I had a little pain. I'll score it about 2 or 3, and that lets you know that okay, maybe something is coming up. Maybe something is about to trigger your crisis, and then you can start pinpointing so that you can start addressing that trigger before it gets worse, before it actually becomes a crisis. So keeping a pain diary is one of the first things to do in terms of your pain plan. Now, when you can easily catch that oncoming crisis, many times you can, with that, help to slow down or even stop the onset of a crisis. Secondly, is now to have certain basic medication, pain medication, anti-malarials present at home. So you shouldn't wait till you get to a hospital or a pharmacy to have something as simple as Panadol at home, something as simple as an anti-malarial like Coartem or Pialaxin. You have to know which one works for you, but you have to have something at home. I always advise warriors to have a set of 2 or 3 analgesics at home. So the simple Panadol, then an NSAID if you don't have ulcer. If you have peptic ulcer, you can have an NSAID. NSAIDs are non-steroidal anti-inflammatory drugs like diclofenac and ibuprofen. But if you're using this, it's always advisable to use it with omeprazole or esomeprazole, which is, a drug that helps to prevent ulcers. So this you should also have at home. Opioids are another group of drugs which I do not really encourage warriors to have at home per se, because it's prone to being addictive. So if it's just the Panadol and the non-steroidal anti-inflammatory drugs that you have at home, have them at home. If you feel malaria coming up, you don't have to wait. You can, if it's at night and you're already having headaches and your mouth is feeling bitter and you're feeling weak, just use it. You won't lose anything from using it. You can always go to the hospital the next day to get, your tests done or to see a doctor. But you would have already started the course of the treatment, which is better than waiting. So have your anti-malarial, have painkillers at home, and start using them. If you can see that, oh, it's because I'm quite stressed physically, then you should know that, okay, I have to take a break. I can't always be involved in this or that activity. So just take a break, sit down, relax at home, and know that, okay, I have to chill. So sometimes this is necessary. You have to know yourself. So you have to have those pain medication as well as some simple drugs at home like anti-malarials. So this is a part of your pain plan. Now, at this point, if you see that you've started using these things, you've upped your intake of water and you're feeling better, then great. You know that you're doing well. However, if you don't start feeling better, within that day, you should know that, okay, I might have to see the doctor. If you feel like, oh, in addition to the pain, you're now having some difficulty breathing and some other added symptoms, then you know that, okay, I definitely have to see my doctor. So then you go into the hospital, because sometimes once those things don't work, then it's a harbinger or a sign that there's something worse going on. So it could be a chest crisis whereby there's a chest infection that needs IV antibiotics, you might need oxygen, you might need red cell exchange. So depending on what it is that is the underlying trigger for a crisis, once it isn't sorted out at home, don't stay at home. Once it's not sorted out within the first 24 to 48 hours, please, please, please see your hematologist. Let them have you fully investigated. If you then need to have any further things done within the hospital, this can be done. So that way you take full control of the care, of your own care. So within the hospital, treatment ranges from, of course, first of all, doing investigations to find out what the trigger for this crisis is, and then treating appropriately. You might need to be given antibiotics, you might need to be put on oxygen, you definitely need to be given IV fluids to help rehydrate. In some people, this is enough. However, if this doesn't work, then we have to go higher, move up the train of treatment, and then probably do a top up transfusion or even do an exchange transfusion in which we take out the sickled cells, we replace with AA blood, and this helps to clear the circulation of the sickled cells and helps, oxygen to flow around the body, as appropriate. So these are things that your doctor, your specialist, will be able to sort out as soon as you're within the hospital. So it's important to take control. Some people can be quite careless and, not really take caution and not really pay enough attention to their health. And then, it gets to a point where it's a little too late. Never let it be too late. Please show up at the hospital just in time. Once it's past, a mild crisis and it's becoming more moderate to severe, and it is not going with your regular interventions at home, then you know that you definitely would need to see a specialist and have yourself checked in the hospital. Thank you.
Thank you so much for that educative narration. One of the things I've realized with pain, how can we get medical doctors to understand the level of pain, or how can we describe it to them? Because sometimes when we say, oh, I'm in pain, the tendencies for people not to believe them, maybe because, like for me now, my pain threshold is high. That means that my capacity for pain, I may not show it as much, but I'm really in pain. So how can we get doctors to understand, okay, the level of pain so that they can treat it accordingly?
So it's always important to have what I call a pain chart. If you Google pain charts on the internet right now, you would always have a scale. Usually it's a color coded scale from 0 to 10, and that just tells you. Sometimes they put a smiley face, where 10 will have a very, very unhappy face with, red or tears, and 0, you're still smiling. And then also maybe colors from green to amber to red, as the pain gets more severe. So, like for instance, in our center, we'll have a pain chart to just show the patient to say, okay, so on a scale of 0, 0 being no pain at all, to a scale of 10, 10 being the worst pain ever, can you give us what score you would, score your pain at this period? So it's important to always have that at the back of one's mind. Even as health professionals, if you don't have a score, how would you really grade the person's response to your treatment?
Yeah.
It's almost impossible. So you have to be able to say, somebody came out with a pain scale of about 9/10 in the right arm, and 2 days later, now it's about 3/10. So you know that yes, you're winning in terms of the, resolution of that pain. So it's important to always have some, because pain is very subjective, as we all know. And like you said, different people have different thresholds. So you have to be able to still say that even though you're not screaming the roof off, my pain is actually 9/10,
Right. Yeah.
So yeah, so that way we can have an understanding of how you feel and we can monitor with that.
Okay. Somebody has a question. She says, can sickle cell be cleared permanently with an AA blood?
No, it cannot be cleared permanently with AA blood. No, that is just a temporary solution for certain indications. So certain times when you have very serious issues like a stroke, acute chest syndrome, severe crisis that isn't going with your other treatments, somebody that has priapism in a male, even chronic pain, there are indications for the red cell exchange, and it's just for the period during which your own body, will produce its own cells, which is about 4 months. So it just helps to remove that immediate problem for that period. But many times it has to be repeated quite often to get the same effect.
Somebody asked, can leg ulcer be cured? This is an issue that is a lot. Yeah.
Yeah, so leg ulcers in sickle cell can be such a pain. Some people have them on for years and years, and it can be terrible, I know. But yes, it can be cured. So it is very possible to get a good, it can be cured. There are people that have had leg ulcers that have gone and come back, gone and come back. So the issue is what exactly is causing the leg
Possible
ulcers.
to go and come back here.
Yes. So if you can pinpoint it, sometimes it's that there's an underlying bone infection. No matter how often that ulcer closes, it will open again once there's something triggering it. Sometimes it could be that the percentage of the sickle cells are so high that there's not enough blood getting to that area of the body, so it keeps breaking down. So sometimes even an exchange works for chronic leg ulcers. So it depends. One needs to investigate properly. If you can investigate properly, many times you can have, those ulcers close up.
Yeah. Somebody asks, notices that he comes down with a crisis every time he takes anti-malaria drug.
Malaria
What could be the
drugs.
drug?
What could be the cause? Right. So so for some people, it's very possible that certain medication actually trigger their crisis. Now, for this kind of person, I don't know whether it's the medication that's triggering the crisis or whether it's the malaria that's triggering the crisis. It's difficult to say. So if you're using anti-malaria drugs, it may be that you actually have malaria that's already causing problems. You use the drug and then you feel like it's the drug that's causing the crisis. It may just be that the malaria has already come to a point where it's enough to trigger the crisis.
Yeah, exactly. Yeah. Abby says, what are the symptoms in sickle cell warrior having a deficiency vitamin D?
Vitamin D. Good question. So, quite a number of symptoms. When it's mild, sometimes it starts with tingling in the tongue or on the lips. Sometimes some people have like a numbness. They say that they can't really feel their lips. Or the tips of their fingers start to tingle. Yeah, you can have some
Really?
tingling in
I've had that
in
before.
the finger. You've had it before. Yeah, so it could be on the fingers, in the toes, and then as it gets more severe, you now start having muscle cramps, muscle weakness, and then they now start having pain. So pain in those muscles, bone pains. As it gets even more severe, they can have serious headaches. They can have really bad muscle weakness where they are not even able to stand up, from the bed. So these kind of things, it depends on the severity of the vitamin D deficiency.
All right. Joy says, how much is bone marrow transplant?
So it depends. It depends on where one is doing it.
Doing
We
it,
haven't
exactly.
started. Yeah, in Nigeria, I know Professor Bazwaye does transplants in Benin,
Yes.
and I think they
And then,
cost somewhere between 10 to 12 million naira.
yeah, and I
Uh,
think Sickle Cell Foundation is planning one soon. They've not put a
okay,
cost to it yet. They just
okay.
have yeah, yeah. So it's
Yeah,
it's
because
a
they're
it's quite
collaborating with.
expensive, and then it's not for everybody. The younger
Not
the
no.
child, the better. Yeah, yeah.
And of course,
There's a
there are
lot of.
side effects. Oh, yeah,
Mm-hmm.
there are side effects. You have to be well informed
Yeah.
about it. You have to really be a candidate for it because it doesn't always work, so you have
Yes.
to really be a candidate for it. Yeah.
Uh, she also asks, does sickle cell reduce the monthly period flow?
Oh, yeah, so it can. Sickle cell can reduce the monthly period flow. First of all, many times it delays the onset of the flow. So for many sickle cell females, what happens is that they don't even see their menses on time. And then when they do start seeing menses, it can be reduced. However, there are so many other things that can reduce monthly flow, regardless of sickle cell. So it's important that one sees a gynecologist to be sure that there's nothing else going on that may be causing that.
Okay. Jumoke asks, does sunlight and vitamin deficiency really work? And what time is best to be under the sun?
Okay, hi Jim. Okay, so so vitamin D is gotten from the sun. Yes, the best time is between 11 a.m. and about 1 p.m. Not hot blazing sun, you just get burnt. So anytime, usually it's around 11, that early morning, 10, 11 to about 12, 1, that's when you get the best vitamin D. Um, of course, maybe you have to be in shorts and sleeveless to actually get it going to the skin.
Still,
So that
yes.
that helps. That helps a lot because even with us in the sunny environment, because we're mostly indoors, we're under the AC, everybody's
Still,
running from the
yeah.
sun. We actually do still have vitamin D deficiency.
Exactly. Fumi is asking, does heart enlargement, can the pain go on forever? Because
I
I
don't
had it
understand.
can. Says heart enlargement, can the pain go forever? Because I had it can't come back to normal. I think
The
it's basically she's
pain.
asked a quick question about heart enlargement before, so maybe
Okay.
because of it she's in constant pain. I'm
Mm,
thinking, and
mm,
maybe she feels that maybe when it's gone, it won't come back or something. I don't know. Fumi,
mm,
if you can explain a bit better for your question, sorry, it
mm,
will help so that we can get a more direct answer.
mm.
Yeah. Okay. Why there's somebody Jumoke says, why does one go into crisis during and after the period of ovulation? I can sort of answer, but you answer that.
Yeah, so pain can trigger pain. Period pains are bad on its own. They can trigger crisis. Ovulation
Mhm.
pain, bad on its own, can trigger crisis. So anything that it's already a stressor on your body. So it's many times it triggers crisis, many times. So you have to be able to manage that pain very well so that it doesn't, turn on the vasoaclusive crisis. Right? Am I right? Sorry.
Yes, yes, yes,
Yeah.
definitely.
I,
And another thing is that the fact that you're even losing as for me anyway, when I was always, you lose a lot of like blood and you become anemic. So there are other issues that arise. And once you start becoming anemic, your PCV drops, it will trigger crisis. So definitely it will cause that. Yeah. All right. So Fumi is trying to explain. She says, I feel pain in my heart almost every day. Have you been able to see? I'm not sure it's. Are you sure it's not chest, like acute chest
Exactly.
syndrome or something? Maybe it's a
Exactly.
chest and you think it's your heart. If it's
Exactly.
likely to be acute chest syndrome, I think you should see a doctor immediately. It's
Yeah.
very important. Let them
Very.
monitor to see if you're
Let's
okay.
even see, let's actually make a diagnosis and know what exactly is going on.
The problem, yes, exactly. Yeah. Abe is asking, is there any age range for sickle cell warriors to get married? Ayo.
Any legal age. Once you're of legal age to get married, you can get married
There's no specific age.
Yeah.
All right. Jada asks, what is the cause of having a severe pain on the waist first before any
First.
other joint? Oh, okay. I think I know what in crisis, sometimes the crisis starts from the spine. It's not really the waist. It starts from the lower spine and creeps up. Then it now triggers other joint pain. So I think that's what she's trying to uh, describe. So maybe you can explain what the cause is
There's
on
no
that.
particular cause. No particular cause that that because it starts from the waist, it's caused by something in particular. No, not necessarily. Many times that's just what people describe. It starts from around there, the back, lower back, the hips, and then spreads to the legs and then the arms. So it doesn't just come bam, affecting all bones at the
Mm,
same time. It always spreads along, and it's always worse in one place than the other. So
yeah.
yeah. Mm.
Mm. Okay, so Fumi is still asking on this. Fumi, I think when you say what can you do by it, we have to determine first is a heart alignment pain. Have you been diagnosed with heart alignment? I don't think your heart can pain you unless I'm wrong, Dr. Shade. I
So
think
there's
you should really
nothing.
need
There's
to go and
nothing.
see.
Yeah, there's nothing like heart enlargement pain. There's no such thing. Never seen it before. There's something going on. You have pain somewhere within your chest wall region,
Mm-hmm.
whatever it is. You need to see a specialist to know what is causing this thing.
Exactly.
You can have heart enlargement from sickle cell cardiomyopathy. Sickle cell cardiomyopathy will not cause pain in your heart. But there are so many other things that will cause pain around that chest region. So it's important, please, you have to have tests done to know exactly what's causing this pain so that it can
Mm.
be it can be handled on time.
Exactly. So, Fumi, please go and say, doctor, if you don't have one or you don't know where to go, you can always DM us and we can recommend somewhere. It's very important. Um, Abe, Abe will say that she said some said it's better to marry for females to marry
On
on time
time.
because of pregnancy. Is it a myth?
So this applies to everybody, right? Sickle cell or not. So it has nothing to do with that. If you have the right age,
Mm,
I think what's important is just go to make sure you finish your studies, have work. Don't just go and get married because you want to get married and get
yes,
pregnant. It's
exactly.
hard work, oh. Yeah, school fees is not cheap. Oh.
I've even
So
had,
we have
I've
people in
even,
their thirties
yeah.
getting
I
pregnant without any issue. Yeah.
Exactly. I think I've even had this. I don't know whether it's a bit, but there was always this story when it concerns fibroid. Somebody tells you that, oh, the earlier you marry, and have a child, the less likely you're going to have fibroid. So I think a lot of this information just gets jumbled up and mixed up together. Yeah. So Temitapa is for a warrior. Is there any such thing as water intake being too much, and what is the possible side effect?
Okay, so yeah, too much. There is such a thing as too much water. There is such a thing as too much water. Of course, typical adults, 60-70% of our body is water. So and if you're going to calculate that, you just need about 3 to 3.5 liters for adequate hydration in a day. So if you're taking 6 liters, 7 liters, it can dilute some of the elements within the body and cause some problems. So for an adult, I would say about 3 to 3.5 liters per day is fine. It's just fine, no issues.
Okay, so the final question goes fast. Okay, I have 3 minutes more before we round up. Fumi is back with. She said she did an echo test, and I was told I had a heart enlargement. Fumi, I don't think. Yes, you may have a heart enlargement, but I don't think the pain is linked to the. I still think you should go see a doctor to be able to determine why you are having pain. Am I right, Dr. Shadi?
So if there's heart enlargement, there are other things that may be going on. But until you check, you can't tell. You can't tell. Yeah, it could be some angina, it could be some blockage of the blood supply to certain parts of the heart. It could be something entirely different. So it's important to do further tests to know what's causing it. Heart enlargement is not enough to cause this pain that you're talking about.
Exactly. So let me check if there are any more other questions. I think that's it. Make sure I don't miss questions. Thank you so much for what you're giving us. I'm sure people are really educated on this matter. Somebody's okay. They are saying thank you, doctor. Thank you, ma. Okay, thanks, ma. Yeah, it's been an enlightening program. Thank you. Yes. All right then. Thanks. So have a lovely weekend. Rest of your weekend.
You too. All right. Bye.
All right. Bye. Okay, guys. We're rounding up. I'm just waiting for gamekeeper to come on, but we're rounding up right now. Somebody was asking about my book earlier on. I'll just play video so you have an idea of where you can get my book. And after that, I'll also play the video of our board member, a video of our board member's book too. And I recommend it to both of you. We're both sickle cell warriors over 50. She's 50 today, and of course, I'm over 50. So I'll play mine first while we wait for the game. Okay, all right. So we are on to the games. I'll start off with. Are we on show by show of emoji? Show that you're ready for it. It's going to be fastest fingers, and we're going to ask a couple of questions that you should be able to answer, and the top 5 fastest fingers will be the one to win our 5 data, 1K data for each person. So my first question will be, what is the full, for those of you who are able to be on yesterday's show, that's why it's good to come on every day so you can win something. For what is the full name of Lepasius Bosse? Fastest fingers. The full name of Lepasius Bosse. Bosse. She was on yesterday. For those of us who can. Okay. Full name of Lepasius Bosse. Okay, in the meantime, Olamide is asking a question. I don't get crisis when I take injection for malaria, only when I take drugs. Maybe the you could be reacting to the drugs. It could be possible. That's a possibility. But I think you should always, when you take drugs or anything, you should always tell your doctor your experience, so that you would be able to know what is really triggering the crisis. So if it's the type of tablet you're taking, they can take you off it and give you an alternative. I hope you're not one of those people who just go and assume that they have malaria and buy the malaria drug. No, it's very important we do the test to determine that it's actually malaria, and then we go to the doctor to know what to take, exactly what to take. All right, so I said, what is the full name of Lepasius Bosse? What is the full, keep it coming, keep it coming. What is the full name of Lepasius Bosse? And then the second question. Second question, which was said yesterday, according to Oluseye Aderunke, when she was talking about the sugar rush effect, which of the following is dates good for? Leg health, hand health, brain health. Which of the following is dates good for? Leg health, hand health, or brain health? I'll repeat that the last time. According to Oluseye Aderunke, which of the following is dates, the fruit dates, good for? Leg health, hand health, or brain health? So we'll wait a bit and get our questions. Keep it coming, keep it coming. The top right, 5 right answers will get a data. Okay. Yep, keep it coming. We want to see the correct answers. Okay. I think we have ended this game. So I'm going to any game after, coming after, any answers coming after Olajumoke Sarah will not qualify. So far, I think we have some winners. They would, our team will contact you. I don't know how they want us to get in touch with you, but maybe they will DM you privately or something. So for the following people, Joy James, one for the question, second question. I think wait, let me check if she's the fastest. That's from, okay, let me start from the first questions. Timitope, yes, one. Michael, yes, you won. Timitope, yes, Michael. Sarah, Fumi, and Michael. Yes, I think that's at the top 5. Really. And then for the second question, Joy James, Abe, Gina, Ola, BC, and Elite Makeovers. But if you want for I'll leave it to our people to collate, because we want 10 people. So if you got your right answers for the first question, we'll give it to somebody else so that we can spread the love around, right? So we're going to take a 45 minutes break. It's not even less than 45 minutes. We'll be back at 6 o'clock with Adire Dewo, I believe, and it's going to be very interesting. Your health life balance or your health work balance. How do you manage your work and also maintain your health at the same time especially in this time of COVID and other issues? So we'll be coming right back. Till then, take a break, drink water, and don't forget to put the notification button on and like the channel, so that as soon as we're back on. So till then, I wish you a nice break and see you again at 6 o'clock.
The least you could do is
Okay.